Are you fascinated by the human mind and passionate about helping others? If so, you might be considering a career in the captivating world of psychology. With a myriad of different paths, the journey can seem daunting. But fear not, we're here to help you navigate. In this showdown, we'll be comparing two popular paths, a master's degree in clinical psychology and a master's in mental health counseling. Today, we're exploring the differences between these two. Let's unravel the mystery together. First, let's define our terms. When we talk about a master's degree in clinical psychology, we're referring to a program that centers around the diagnosis and treatment of mental illnesses and psychological disorders. This is a research-heavy degree, often serving as a stepping stone to a doctoral program. It also lays the groundwork for licensure as a clinical psychologist, equipping you with the tools to delve deep into the complexities of the human mind. Now, a master's in mental health counseling takes a slightly different approach. This degree emphasizes therapeutic strategies and techniques aimed at bolstering mental health. While clinical psychology is more diagnosis-oriented, mental health counseling focuses on facilitating wellness and growth in clients' lives. The goal here is to prepare you for licensure as a mental health counselor, a role that often involves creating and implementing treatment plans and conducting counseling sessions. In essence, these two degrees represent two sides of the same coin, both rooted in the study of human behavior and mental processes, yet diverging in their practical applications. A master's in clinical psychology will typically involve a deep dive into topics such as psychopathology, psychotherapy, psychological assessment, and research methods. The emphasis here is on understanding the underpinnings of mental disorders and how to treat them. On the other hand, a master's in mental health counseling might cover areas like counseling skills, theories of counseling, human growth and development, and ethics in counseling. Here, the focus shifts from why to how to help clients navigate their mental health challenges, how to foster resilience, how to facilitate change. So, which path is the right one for you? That depends on your personal interests and career goals. If you're drawn to research and the diagnostic side of psychology, a master's in clinical psychology might be your best bet. But if you're more interested in hands-on therapeutic work and long-term client support, a master's in mental health counseling could be the path for you. Each degree has its unique focus, one on research and diagnosis, the other on therapeutic techniques and mental health support. Educationally, both degrees require a bachelor's degree for entry, but that's just the jumping-off point. Let's dive a little deeper into what each educational path entails. The journey towards a master's in clinical psychology begins with a strong foundation in psychological theory. You'll delve into the fascinating world of human behavior and cognition, exploring how our minds work, and sometimes how they falter. You'll also learn research methods, equipping you with the tools to investigate and understand mental health disorders. But it's not all theory and research. Practical application is key. So expect internships or practicums in clinical settings to be a core component of your program. These hands-on experiences will allow you to apply what you've learned in the classroom to real-world situations under the guidance of experienced professionals. If you opt for a master's in mental health counseling, your educational path will look a bit different. This degree places a heavier emphasis on therapeutic techniques and strategies. You'll learn how to support clients' mental health, developing the skills to devise effective treatment plans and conduct meaningful counseling sessions. Ethics will also play a big role in your studies, ensuring you understand the responsibilities and moral obligations of your profession. Much like the clinical psychology path, you'll gain practical skills through supervised clinical hours. These real-life experiences will give you the opportunity to hone your counseling techniques under the watchful eye of seasoned practitioners. In essence, both degrees provide a mix of theory and practical experience, but with a different emphasis. The clinical psychology path leans more towards research and diagnosis, while mental health counseling gears you towards direct patient care and therapeutic strategies. Each path offers its own unique challenges and rewards, and both are stepping stones to a fulfilling career in mental health. So, which path will you choose? So, what can you do with these degrees? Well, let's dive into the exciting world of career possibilities. If you opt for a master's in clinical psychology, your career path might lead you to becoming a licensed psychologist. You could find yourself working in mental health services, conducting critical research, or diagnosing and treating severe psychological disorders. If the world of academia intrigues you, you could even continue your studies in a doctoral program. On the other hand, a master's in mental health counseling could open doors to become a licensed counselor. This could see you working in a variety of settings such as private practices, schools, hospitals, or community organizations. Your primary focus would be on direct patient care, helping individuals manage their mental health and navigate life's stressors. But that's not all. Both degrees offer a wide range of job roles and work settings. You could work in rehabilitation centers, correctional facilities, or even corporate organizations, helping employees manage their work-life balance and stress levels. And if you have a passion for influencing policy and advocating for mental health at a larger scale, you could consider roles in government or nonprofit organizations. Here, you could work towards shaping mental health policies, developing mental health programs, or raising awareness about mental health issues. Beyond these, there are opportunities in research and academia. You could contribute to the body of knowledge in psychology, teaching the next generation of psychologists and counselors, or conducting research to understand mental health better and develop more effective treatments. Your choice between clinical psychology and mental health counseling could also influence the population you serve. You could work with children, adolescents, adults, or the elderly. You could specialize in working with certain groups such as veterans, individuals with addiction issues, or those dealing with trauma. The possibilities are vast and varied. Each path offers its unique rewards and challenges. It's all about finding the one that aligns with your passion and career goals. Remember, your degree is just the start of your journey. It's a stepping stone to a fulfilling career helping others, contributing to the field of mental health, and making a difference in people's lives. Your degree could lead to a variety of roles, depending on your interests and career goals. But what does the work of a clinical psychologist and a mental health counselor look like in practice? Well, let's dive into the day-to-day realities of these professions. A clinical psychologist's work primarily revolves around diagnosing and treating severe psychological disorders. They might spend their day conducting thorough assessments, utilizing a variety of standardized tests, clinical interviews, and observation methods. This helps them understand the root of their patient's struggles and develop an appropriate treatment plan. Treatment often involves psychotherapy, where they use evidence-based techniques to help patients manage their symptoms and improve their quality of life. It's a fascinating, albeit challenging role that requires a deep understanding of the complex human psyche. On the flip side, mental health counselors work with clients on managing their mental health, often dealing with issues such as anxiety, depression, and life stressors. They may not typically deal with severe psychological disorders, but their work is no less important. Their day might be filled with counseling sessions, where they provide a safe and supportive environment for their clients to express their feelings and challenges. They use therapeutic techniques to help clients cope with stress, improve relationships, and navigate life's ups and downs. They often provide long-term support, journeying with clients through various stages of their lives. While both roles involve therapeutic relationships, the key difference lies in their approach and patient population. Clinical psychologists delve deeper into severe mental health issues, focusing on diagnosis and treatment. Mental health counselors, on the other hand, concentrate on providing support and coping strategies for those dealing with everyday mental health challenges or less severe disorders. Remember, both professions require empathy, excellent communication skills, and a passion for helping others. The choice between the two often depends on your interest in dealing with complex psychological disorders versus providing supportive counseling for general mental health issues. Whether dealing with severe disorders or everyday stressors, both roles play a vital part in supporting mental health. Choosing between these two paths depends on your career goals and interests. Are you intrigued by the prospect of diagnosing and treating severe psychological disorders, conducting research, and maybe even heading towards a doctorate? Then a master's in clinical psychology might be your path. Or perhaps you're drawn to the idea of providing therapeutic support, helping individuals navigate life's challenges, and dealing with more common mental health issues like depression and anxiety. In that case, a master's in mental health counseling might be more your speed. Remember, this isn't a one-size-fits-all situation. Take a step back, reflect on your passion, your strengths, and the population you want to serve. Do you envision yourself more as a researcher, a clinician, or a counselor? In the end, it's all about aligning your career path with your personal and professional aspirations. Consider what aspects of mental health work you're most passionate about and the type of impact you want to make. So, there you have it. We've journeyed through the fascinating world of clinical psychology and mental health counseling, highlighting their distinct educational pathways, practical applications, and unique career outcomes. Remember, your choice between these two paths hinges on your interests, career goals, and the population you wish to serve. No matter what you decide, know that you're stepping into a rewarding career where your passion for understanding the human mind can truly make a difference. Whether you choose clinical psychology or mental health counseling, you're embarking on a rewarding career path where you can truly make a difference.